a lot of you on this call will already have some idea of what the law says in relation to disability equality, and you'll have some understanding of the Equality Act 2010, which outlaws discrimination against disabled people and also brings in a thing called reasonable adjustments. And reasonable adjustments are about recognising really the social model of disability, that disabled people face barriers in society, and it's all about overcoming those barriers, doing what we can to tackle those barriers, and that's what a reasonable adjustment is. And a big thing that we need to do when we are in the workplace arguing about these issues is to, first of all, prove our member is disabled. And I'm sure Julie will go through in detail with you later in the webinar how we prove a member is disabled. The Equality Act 2010 says a disabled worker is somebody who has a physical or mental impairment that has lasted or is likely to last 12 months or more, and that has a significant impact on their day-to-day activities. And then the next step is we need to prove in the workplace that that person's entitled to reasonable adjustments, and that would be that they face a disadvantage at work. So what do we do as trade unions in the workplace when we're putting these sorts of legal rights into action? So there's three key areas really that we focus on as unions, and that is individual representation, then collective bargaining and negotiating, and finally campaigning. In terms of individual representation, which I know many of you on this call will be very much involved in, and probably more than me, we of course represent members every day on issues related to disability, whether that's discrimination or reasonable adjustments. We do that every day. We sit in meetings with the employer and with members, and we argue the case that, first of all, this member is disabled, even if the employer is trying to argue that they're not, and that they're entitled to reasonable adjustments, or that they're being discriminated against in some way by employer action. There is a right to be accompanied, as you will know, to formal meetings such as disciplinaries and capabilities and all of those kind of meetings and grievance meetings. But I think we also spend quite a bit of time in informal meetings, often to do with sickness absence as well, to try and get the employer to understand that sickness may be disability related and that there needs to be an approach to sickness absence that takes into account reasonable adjustments. So, for example, reducing the triggers when a formal sickness absence process might be kicked into place. So that's a huge part of our work. We do that one-to-one individual work every day. It's our bread and butter as trade unionists. And it's important that we know the law. And like I say, I know Julie will go through that in more detail with you in a moment. But the second area where we're really involved as unions on disability equality is in bargaining and negotiation. And this is about an understanding that we can spend all the time in the world on individual cases, but actually we want to change the system. We want to make sure that everyone in that workplace gets the rights that they are entitled to. And also that we don't spend loads of trade union time and loads of employer time arguing about individual issues, when what we need to do is agree a policy that covers the whole of the workplace. And then you have consistency across the workplace. You make sure everyone gets what they're entitled to, and there's no special treatment or discrimination. So in terms of bargaining in the disability space, the main things that UNISON focuses on, and other unions are very similar in this regard, would be on reasonable adjustment policies and passports, disability leave policies, and also mental health policies. Now, we do look at other areas, but they're probably the key areas. So reasonable adjustment policies, it's amazing that actually there are still employers out there that don't have a clear policy on how somebody would ask for reasonable adjustments and how that process would be gone through, how you would appeal, etc. There are lots of employers out there that don't have that. So we in UNISON, we've got our own guide, hopefully you can see it here, and this is our guide to bargaining with employers on reasonable adjustment policies. So we've got a model policy and we go to the employer and we try and get them to agree that model policy. We've also got what's called an adjustment passport, and increasingly trade unions are trying to negotiate adjustment passports with employers. Now the reason is that we often have experiences in the workplace that our members would, go through probably, 5 or 6 meetings, arguing with occupational health and with HR, and eventually get adjustments agreed. And then either they change to a different team or their manager changes. And suddenly they've got to go through that whole process again and get their adjustments agreed a second time. So to make sure that doesn't keep happening, this idea of a passport system is extremely useful. And it means that you just agree your adjustments once, they're recorded, and then that is agreed whether you change jobs within the employer or you get a new manager. So again, our guide includes in it a template passport that you can again hand to the employer and ask them to agree. There are lots of reasons why employers will say no to this stuff. They've always got that comeback, and we include in our guide some of the kind of frequently asked questions from employers and how you rebut those. The other area that we negotiate, as I said, was disability leave. And again, in UNISON, we've got a guide to negotiating disability leave. Other unions, other versions are available from other unions. Of course, I'm going to say UNISON's is a good one, but they're all good. So do have a look at your own union's website and see if you've got similar guides. Our disability leave guide particularly focuses on this issue because it's a big issue for our members. I'm going to tell you a little bit in a second about a survey that we just recently did. But what we want to do is make sure that when people, when our members have need to take time off for a reason related to their disability, that instead of trying to argue that with their individual manager, there is a policy in place that makes clear what they're entitled to. And it's one of the biggest areas that you can make a difference for disabled workers, because it's an area that at the moment, a lot of employers don't have a clear policy, and we've got lots of issues around it. The third area that we bargain and negotiate on in workplaces is mental health. Again, I've got another bargaining guide on mental health that's on the UNISON website, but I don't have a prop with me for that one, I'm afraid. But that's another big area. And what we do is we again have a mental health policy that we can get employers to agree to, but we also look at all policies across the board, because what we really need to make sure is that mental health is integrated, an understanding of mental health is integrated into all the employers' policies, including, for example, reorganization policies and that kind of thing. So those are the three key areas that we negotiate on. And like I say, we do have in what we produce lists of the sort of comeback you might get from employers, which includes things like, oh, we can't do this because it would treat, it would be unfair on people who aren't disabled. It's amazing how often employers say that. I'm sure lots of you have heard it. And they fundamentally don't understand the Equality Act if that's what they argue, because the Equality Act 2010 actually says that you need to treat disabled people more favourably if that is a reasonable adjustment. So we explain in our guide how to argue that back to the employer. So that's the kind of the representation and the bargaining and negotiating side of what unions do. The third area I just wanted to mention was campaigning, because we can do all of this work with employers and with individual members, but really, we operate within a legal system and a system of rights and responsibilities that itself sometimes needs to be changed and isn't quite good enough. So all unions will campaign on disability equality as well. And I just wanted to give you a little bit of background on some of our campaigning asks at the moment and where they come from. We recently did a survey of disabled workers in UNISON. About 3,000 disabled workers responded, and we asked them what their experience of reasonable adjustments was. And 48% of them said that they needed reasonable adjustments in the workplace, but 74% of people said they had been refused some or all of the adjustments that they needed. And a lot of people came back to us and said that the reason they were never actually given a reason for refusal. So they just didn't hear back from the employer at all. They never got a response. Those that did get a response were told things like, it's not our policy, it would impact the performance of the team, that kind of thing. Even where members did get a response and were told they could have the adjustments they required, 23% of them waited a year or more for the adjustments they needed. So I just wanted to pull out that experience, because the big problem that members face, disabled members face, is not getting a reply when they ask for reasonable adjustments. And if they do get a reply, having to wait over a year to get the adjustments put in place. So as a result, UNISON and some of the other unions, including Unite and UCU and PCS, we are all signatories to what's called the Disability Employment Charter. And this is a campaigning tool. It's made up of 9 asks of the government. So they're demands that we're making of the government. They're not about getting employers to do something, they're about getting the government to do something. And one of the key demands is that that there is a 2-week deadline for responses from employers to reasonable adjustment requests, because we think that would make a massive difference to disabled workers. And another demand in the Disability Employment Charter is for a much stronger right to disability leave. I'm sure there's lots of people on this call who are saying, disability leave? I never heard of it, I never get it. And that's been our experience. About 60% of people we asked had never didn't know their employer would give disability leave. It is quite difficult to negotiate it. The reason being, it's not written into the Equality Act. It's an example of a reasonable adjustment that is mentioned in the Code of Practice that sits under the Equality Act 2010. So we want to see that strengthened. So this Disability Employment Charter has now been signed by over 130 employers, which is an amazing result, because what we need to say to government always says that this kind of thing is red tape or it's a burden on business. But what we can say to government is 130 employers have already signed to say they agree with us on this. They agree with these changes, and it includes publishing the disability employment gap, for example. So it's not a burden on business, and it's something that government should look at implementing.
So the Equality Act has made it easier for a person to show that they are disabled and protected from disability discrimination. Under the Act, a person is disabled if they have a physical or mental impairment which has a substantial and long-term adverse effect on their ability to carry out normal day-to-day activities, which could include things like using a telephone, reading a book, or using public transport. To be protected under the Act, workers have to show they have a physical or mental impairment which has a substantial and long-term adverse effect on their ability to carry out normal day-to-day activities. People do not lose the right to protection against discrimination because they have been able to control or correct their disability. For example, if they have medical treatment or use aids. So the effect of that treatment must be disregarded when you're assessing whether or not someone is disabled. Now, of course, this provision does not apply to someone who wears glasses or contact lenses. People who have a disability in the past are also covered under the Equality Act 2010, as are people with progressive conditions and anyone deemed to have a disability, such as those who have been diagnosed with HIV, cancer, and multiple sclerosis. It's also important to note that babies and children under the age of 6 who have an impairment are also covered. Now, this is significantly for the purpose of associative discrimination, so that a parent of a child with an impairment will be protected even if the child's condition does not yet have a substantial adverse effect on the child's ability to carry out normal day-to-day activities, but it may do in the future. So in order to satisfy the definition of the Act, the disability must either have lasted at least 12 months, or be likely to last at least 12 months, or be likely to last for the rest of that person's lifetime if that's less than 12 months. The Act also covers people whose conditions may involve periods of remission. Although the impairment may no longer have an adverse impact, it will still be deemed to have that effect if it's likely to reoccur. It's important to understand the different types of discrimination, disability discrimination, so you know how to support your members and in order to know their rights and responsibilities under the discrimination law. So disability discrimination covers Direct or indirect discrimination, so that's when someone is put at a disadvantage and treated less favourably because of their disability. Discrimination arising from disability, this is very specific to just the disability elements of the Equality Act. So this is when someone is treated badly or put at a disadvantage, not because of their disability itself, but it's because of something that's a result of their disability. For this type of discrimination, it's also important to note that the person does not have to compare how they are treated to how someone else is treated for the law to apply. It does not apply if the person or the organisation treating the person unfavourably did not know or could not have reasonably have expected to know about the disability. So that's why it's a bit different. The third type of discrimination is failure to make reasonable adjustments, and that's when an employer knows or should reasonably expect to know that a job applicant or an employee has a disability. And if they do, they must consider if they need to make reasonable adjustments and make adjustments as soon as they can if the changes are reasonable. The next part is harassment. So that is when bullying or unwanted behaviour is related to disability. And then finally, there's victimisation. And again, this is when someone is treated differently or less favourably because they made or they support a complaint to do with disability, or someone thinks they did or might do.
I'm very lucky to be part of a trust, Lincolnshire NHS Partnership Foundation Trust, that has an equality lead that has worked tirelessly over these years to promote some very, very efficient workplace staff networks. We have a women's group, we have a men's group, we have a MAPLE group, which is the Disability Lived Experience group. We have LGBTB plus group, which has got a Stonewall recognised employer at a high level, very high level. It's gold or silver standard. And we have a race group. And it's those sorts of staff networks that a few months ago, the Equality Lead turned around and said to us union activists that she was so grateful of us unions. Why? Because we've often got our finger on the pulse ahead of things. Hence, meetings like this and the policies that you see, including the reasonable adjustment passport, get handed over to employers for them to adopt. And as UNISON explained, you can alter them to your own needs. I myself ended up using that passport myself this year because of COVID and because of a change of circumstances. I have quite a few disabilities, the main ones being that I have only half a lung on my left side. Post-TB, post-breast cancer, damage. It killed my left lower lobe. I also have a recognised COPD condition, which means when COVID hit, I was, like a lot of people, restricted to home. And then they gave me work at home. Work that I've not done before, was a privilege, being able to support people in the community over the phone. And now I'm in a role as of April this year, which is totally different to what I'm used to. I don't always find it easy because I'm a person that likes to be face-to-face with patients, but it's the referral line. You don't need me to tell you that our referrals have increased and our people that we support in the community are very stressed and mental health has gone through the roof. But as reps on the ground floor, we need to equip our members. Our members are looking to you. I've been looking at some of the comments in the chat, and I can see we've always got a lot of work to do. This month is Disability History Month. And let me go back to one of those staff networks that I spoke about, the MAPLE group. This month alone, the United Hospital Trust, which is one of the other Lincoln trusts in this county, in Lincoln, and our trust, and the Community NHS Trust put together several lived experienced webinars. They included having a speaker from the workforce disability equality standards to come and explain how that is working nationally and explain it to us on the ground floor and how effective it's been. They included the chief executive of United Hospital Trust, who himself has a disability caused from polio and walks with a caliper, to prove that, it doesn't matter who you are, you can get to the top if you really want to. And I myself was asked to present my presentation, which I admit I was very nervous to do, because it's easier for me talking about generalized issues that affect all of us than talking about issues that affect myself. But the point is, he was the chief executive. Other people that we had on our webinars was one brave, very, very inspirational young lady who has won gold medals and has been to Invictus Games. She was originally a netball player and got many disabilities through playing that game, but had to change her role to be one of our well-known rowers. But the difference is there, people that do that are because they won't give in. I've recently been following, and my partner finds it hilarious, because I tend to see things like to inspire me, and then I can get fixed on them. But it's a long old, bit slightly dated series called Highway to Heaven. And one of the characters in that Highway to Heaven, one of the episodes featured a gentleman that was paraplegic from the neck down. And do you know what he wanted to be? Apart from trying to get through to a young person who'd suffered a road traffic accident and basically felt that was it, his life was over. And he told him basically, get in the closet because you're holding people like me back. Why? Because he said, I focus on what I can do, not what I can't do. And that gentleman went on to be a lawyer. And he encountered difficulties as a lawyer, because as soon as people saw him in a wheelchair, they thought, not getting him represented me. So there was a later episode of showing him getting despondent, getting down, thinking, well, I've got this far and I can't do anything. And then the perfect case came along. A young man that had grown up with a demarcation on his face, that his mother had hid him in the house, told him, don't ever go out because people are scared of you. And the whole community called him a monster. And the fairy tale situation occurred. He fell in love with a lady that was blind, that found out that through the advancements in medicine that they were going to be able to get her sight back. So he ran off. She had an accident. And guess what? He was at the scene when the accident happened. And he's the one who got arrested. Branded a murderer, branded that he should go down. And who was the lawyer? You guessed it. The paraplegic, the lawyer. And he got that person off. He proved that it doesn't matter. Don't see what he was. See what he can do. And that example on that screen, when I watched him, I thought, that's it, spot on. That's exactly it. That's the role those reps need to do on the ground floor. We need to empower our members that no matter what they bring to us, we're there to defend them, to encourage them not to give up. We've got the 2010 Equality Act backing us up. We've got other acts like the Autism Act and the numerous different policies that are in place to protect that person. But the other thing you have to have is belief that you can do it. When I was faced with having to leave the trust that I've loved working for, that has produced these staff networks and that keeps striving to make changes for the better of the staff that they're employing. And not just because it looks good, but because they genuinely believe in inclusion and equality, to the point that one of our race groups was looking at the BAME argument. We need a different word. Our Maple group is looking for a different word to the Maple group. We've just got to try and find it. And we will do. Last night, I was on our GMB National Disability Strand meeting. And what were we looking at? Finding alternative word to hidden disabilities. It's groups like that and the work we do within the unions, within our staff networks, and combined with the work that our employers do that have staff networks dedicated to looking at these issues, even down to our terminology, is where progress comes. Because somewhere there'll be a group of people, doesn't matter whether it's ideally through the hospitals, backed by our unions, because we're also doing this work, the TUC at the helm of it, that will come out and say, no, we found this word, or no, we found that colour, or like this lanyard that I've got around my neck, that hasn't come through just somebody's whim, that's come through long, hard felt feelings. I have a colleague that's part of the United Hospital Trust that has the background of this, and when I was talking to the other day, I was so drawn to the sunflower. Why? Because it's hopeful, it's positive, it's something you can grasp, you can't help but look at it, and that's where we're coming from. I wrote my passport this year, and I've never actually used it properly, but I used it properly this year. It meant that I could get HR before I started my alternative post, get my new manager, have my rep beside me, and we sat down and we discussed my needs. I had to write them down. It wasn't easy writing them down, but I tell you something, it made a difference because it made me think of what I can do. And that was the thing that I had to force myself to do, what I can do. And with all the things that everybody comes with, whether hidden or visual, they're real to us. And somebody made a point last night, which I thought sums up a lot of things that goes across anyone with a disability, and that is you cannot measure pain. You cannot measure pain. And that's something that a lot of us with disabilities have, whether it's pain psychologically, it's pain physically. In the workplace, everyone has a right, I'll say it again, to be able to work. And one thing that the trust that I work for, and that the GMB actually brought to the TUC through a member standing a head above the parapet and saying, I'm not going to be forced out of work. And at that time, by the way, reasonable adjustment passport was being developed. One of our members was on the TUC, sadly he died last year, but he made a very strong point that passport can also be used in short-term scenarios when someone's broken the leg or something and needs a temporary change of their working conditions. And that's further work that we as unions will be looking at, because he wanted to point that out and encourage our reps. We need to be getting our members to use it with our employers. And we know that there are employers out there that don't believe in it. We know that. We're well aware of it. That's why we keep on banging it about using it. But it made a difference when I used it, because the HR listened to me. We put things in place now. We put things in place back then. We had review meetings a few weeks later. I'm working from home because again, the trains are on strike. My boss asked me about my health. I don't want to be stuck at a train station late on at night. Wouldn't do me any good. So the point is, these things are in place for you and me to work on. But we need to work together, like our equality lead said the other month. You know, unions have got their finger on the pulse. And it's just as well they've got their finger on the pulse. A few weeks ago, or quite recently, it was Human Rights Day. A few weeks even further back, I was stood in the street with trade union campaigning, supporting our members on strike. And the colleague read out what the current government's plans are, and that is to give the police powers to restrict the work that we do. And that includes encouraging our members to be active and encouraging our members to stand up for their rights. The Human Rights Act is under attack, and it's through unions like us that we need to reinforce to value them, because they come down to our basic rights, all the things that we sometimes take for granted. And disability is one that we have continually got to battle with. We know that it's an issue for employers. But if they want to get the best out of us, if they want to keep us working, like the lady that I was talking about earlier, who incidentally, that's where the Dying to Work campaign came from. My trust signed up to that. And that's because she said, I'm not ready to give up because I've got cancer. But for different kinds of illnesses, If you want to help your members keep on working, then remember why we're reps on the ground floor. Remember why Disability History Month is to be celebrated. And remember what that paraplegic said. I want to focus on the things I can do, not on the things I can't do. And as reps, we need to be there for our members, to remember that they can do that, and with employers, help them to produce the best they can do, not just for accolades, but because they need to believe, and in the caring industry, even more so, believe that our staff are as important to them, not just a number. Thank you for listening.
So we've had quite a lot of questions, and I have picked out a number which I think we can focus on. So one that I think that will be relevant to everyone, because, you know, we are on a trade union event. So the question asks, how can we ensure disabled trade union members get the reasonable adjustments within their trade union branches to remove barriers to disabled members' full participation within our union structures? So it's quite a long question, but basically, what can we do as members to ensure that barriers are removed for our disabled members, colleagues? So I think I might put that question first of all to Deirdre, because you've got experience in within at one of our unions, and if you've got any examples of what you've done to remove barriers. So over to you.
Great, thanks. And it's a good question, isn't it? Because you know, we spend a lot of our time telling employers what to do, but we've also got to make sure that we are, you know, in the same way, making sure that our disabled trade union members have the full right to participate within the union. And I know other unions are similar to UNISON in that we operate a reasonable adjustment policy for our activists. And whether you're attending a national committee meeting or attending, you know, education events, you can request reasonable adjustments, and we put those in place for you. So all unions should be doing that, and I'm sure are doing that. However, I think we can take a further step, and that's certainly what we've been doing in UNISON. So we've piloted our own version of a passport, so that you don't have to keep on requesting adjustments when you go to different events or you know, different committees within the union. Because I know, you know, activists can end up being on lots of different parts of the union, and sometimes you can have like an inconsistent response to your requests. So what we're trying to do in UNISON is bring in more of a joined up process on reasonable adjustments. So that would mean that you fill in your reasonable adjustment passport, and then that's what you get, whatever union event that you attend within the union. And we also agreed, as part of some other changes that we brought into the union, that we're going to move towards a national reasonable adjustment pot, so that we don't have issues with, you know, some branches saying we can't afford reasonable adjustments, or maybe regions saying they can't afford it. We're moving towards having a national pot, so we don't have those issues in the future. And I know other unions are looking at similar approaches like that. But the fundamental point is we're making sure that we're actually ahead of the game, that we're actually, you know, best practice as trade unions, and showing employers how it's done in making sure our activists are able to fully participate in the union.
Thank you for that overview of the work you've been doing in UNISON, Deirdre. I'm just going to ask Dawn, also from the trade union experience, what she recommends, what we can do as trade unionists to remove barriers in our branches. So Dawn, I'm just going to bring you up so you can put your thoughts to that question as well, please.
I think to remove barriers within our branches, well, for a start, have we got equality officers in place? Because that's the first step. I know with our union, it's a role. It's not necessarily, admitted it's voluntary, but it's a role that's important. Do we give allowances for members to be trained up? There are plenty of different training programs available, and certainly as unions we're developing, whether, for example, the menopause toolkit, ours has had train the trainer alongside what, as we've seen on the media, I know at work as well, the menopause group is extremely strong. It's got peer support, but you do need to have those sort of reps in place and to help develop that. And look within the communities. If you've got reps in place that are dedicated to looking at these issues, even if it's no matter what kind of disability a person has, then you've got to start, because that makes a difference. And if you've got a branch where there isn't many people that come under the protected characters, is there anyone interested in looking at these things? You've got to start somewhere, because even if you haven't got it, your members will. There'll be somebody within your area that does need you. So it's about keeping up abreast with current affairs, what training is about, and embracing them.
Thank you for that overview there of your experience as well, Dawn. I think that is a really key point about what we can do in a branch, having equality officers, or whatever term you might give to that role. That's, I think, really key in taking that agenda forward. I've got a bit of a question for you, Julie. Despite the audio problems we were having in hearing you, I can see that you are posting answers in the chat. We have a couple of legal questions that have been posted, or policy overview. I'm thinking what we could do is maybe send them to you and you write a short answer. I'm just a bit wary that I want to make this accessible for everyone. So rather than put them to you now, I might put them to you afterwards, if that's okay, and we'll still send those answers out to our audience. So please don't feel, if you've posted a question, that I'm going to ignore it. I'm still going to put it to our experts and our speakers. Right. I'm going to just find another question here that we've had. So we've had a question about the about particular sectors here, and our viewer asks about reasonable adjustments in a school situation, but I'd like to broaden that out a bit. In sectors that are public facing, perhaps healthcare or education, or perhaps retail, where there are those dealings with the public in a way that other jobs aren't. What can we do about reasonable adjustments there? What are some of the reasonable adjustments that we can make? And once again, I am going to ask Deirdre, because UNISON, as we know, is a public sector union. I'm going to ask for her thoughts on this first of all. So reasonable adjustments in a public-facing setting, please.
Right, thanks. And I did see that question in the chat, which was specifically about teaching staff. But as you say, we can also broaden that out. I think there's a real lack of creativity, I think, from employers. And this is where unions come in. We've got to help them to think outside the box a bit. And the reason I think that is not just this question, but also working from home more generally. So we've in our recent survey, about, I'm trying to remember the figures here, but anyway, a large number of people said that they were turned down for working from home, 47%. So yeah, a large number of people, they were turned down from working from home because their employer said that the job wasn't suitable for working from home, okay? But when we asked those members, do you think that there could be changes made to your job that would allow you to work from home? 90% of them said that they felt that there could be changes made to their job. So, if you see from that, employers are coming to jobs with a very closed mind, and they're assuming that changes can't be made. And that's not just about working from home, it's to do with, all adjustments really. So I think our job, whether it is people who are delivering kind of those, in-person frontline services, or, other kinds of roles, our job is to try and get the employer to be much more creative. Occupational health is important in this. We sometimes have, there's positive and negative experiences of occupational health, but when they're good, they can be quite helpful in thinking what could be a reasonable adjustment that would allow this person to continue doing their job. So I think that's very, very much our role, to get them to consider that. Now, redeployment, I think a lot of people experienced during COVID, particularly in NHS roles, that redeployment can work in some circumstances. And we'd certainly support it where the member supports redeployment. However, I think we've got to be really clear that it's got to be the member's choice, and people can't be redeployed to these pools that you end up in for 12 weeks and then suddenly you've got no job. It's redeployment to a real job that is adjusted so that it's something that you were able to thrive in doing. So that would be, I think, the approach that I would recommend.
Thank you for that, Deirdre. That's really helpful again. I think I'm going to get one more question from our panel, and then I am going to send a couple that are more legally focused or policy focused to Julie. Right, 1 second. Let me find another question. They keep moving around in my list, so that's why it's tricky to always find them. So we've talked a lot today about reasonable adjustments and about the kinds of adjustments we can have. And we have also shared with you the links to our reasonable adjustments training, information, resources, etc. But just a few people have asked for what the significance is of having or not having a formal diagnosis when proving discrimination or requesting reasonable adjustments. So I'm going to come first of all here to Dawn, just to talk about maybe the experience she's had in this area, and then if needs be, I'll put the question back also to the other speakers. So Dawn, formal diagnosis information, please, when seeking adjustments or proving discrimination.
Well, when it comes to formal diagnosis, I mean, it's a bit like when you apply for PIP and things like that. They always want evidence. So, and I mean, a classic example even now is look at long COVID. That is one that unions are doing their level best to get that recognised as a long-term condition. If you think about the Discrimination Act, and when it defines on the Equality Act of 2010, when it talks about a condition as to whether it's a disability, as in a long term, it's got to be longer than 6 months to a year, and it's something that limits you from day to day. And when you fill in a PIP form and any forms into that, are they not asking the same? You're looking for medical evidence. And I know if I take myself, it's got to be something that does limit you. It does alter you, whether it's small or minor. And it's about whether if it's going to make an effect on you in your daily working life. I mean, I can think of a member that I supported recently with dyslexia. It took a long time for her to get through to her employer to get this particular apparatus that wasn't cheap to help her in how she wrote her notes. They got it in the end. Sadly, it's a bit too late, but because that person moved on because they unfortunately faced discrimination from the team that she was under. But the point is, they got it. And that's the thing. If you can get the equipment that's required for your members, for the members of staff, that makes a difference. But when it comes to diagnosis, a lot of the time they're looking for what's written down on paper. Now, you might not always have gone to your doctors for this or been under consultant. I've been under 5 or 6 at one time over the years. And, you know, it's in black and white at your GPs. But not everything's always so easily defined. And I mean, with my own case, with my lung, I didn't know that. It was just through one circumstance after another. And I happened to got a very good GP who listened to me and sent me on to be checked out, that mine came to light, because I'd had partly bronchiectasis hides behind asthma. So you do need that sort of backing, and you need to have the courage to ask for these things. And when it comes to employers, across any sector, if they really value you as a person, they will listen. And that's the point. But it's also about you standing up and saying, look, you know, I've got this condition. I want to work. I can do this, this, and this. I just need help. Can you help me to look at how I can work effectively within my limitation? So it is a two-way process.
Thank you, Dawn. I think that was really helpful there, and your really key point from your last comments there about if your employer values you, they will listen to you. I think that is and really essential that we can take away. Okay, so we have gone a little bit over time, and I want to thank you all again for your patience with the technical issues we've had on this webinar. I appreciate how frustrating and annoying and excluding it can be. So thank you if you have joined, you've stayed with us to the end. We are working on some technical improvements for next year's programme, and I do hope you'll join on some of those that we have planned for the new year. I'd like to thank each of our speakers, that's Julie, Deirdre, and Dawn, for their contributions today. I'd also like to thank our captioner, and I'd like to thank our two amazing BSL interpreters who you've seen move in and out of the screen. I'd also like to thank you, your audience, our audience. You've been great as ever. You've given us a real insight into your experiences, and as ever, you've asked insightful questions. So I wish you all a good festive season, and I'll see you in January for more making a difference in the workplace, as we all do, and we all do every day as reps. So bye-bye for now, and see you again soon, and thank you again.